you so much for joining me. So you have a little bit of a trick up your sleeve here. I was wondering if you could tell me about these cards that you're holding.
Oh, the health axioms.
Yes.
They are,
Can we see them?
these are the health axioms.
Health axiom.
Well, it's a flashcard with a single idea, single habit, a single health behavior that humans should probably concentrate on. And there are several dozen of them, and they start from move more to eat food not too much, mostly plants. And it goes deeper, exercises, medicine, all these guys, and it gets more and more complex as you go through. And they're an open source deck that on the front are highly pictorial. There's like this little mini graphic novel on the front. On the back are easy to follow highlights to how you sort of better improve your health. So that's the quickie gist of the health axioms.
Who are they for?
They are primarily for humans, for patients, for people who want to do a little habit changing. They're for clinicians who use them in their practice, and we're getting more and more of that, where they can hand out 2 or 3 key ideas to patients who need particular help in an area. So we're finding that sub-packs are popular just for type 2 diabetes or pre-type 2, where they give move more, get more sleep, food is medicine, some basic tenets of how you start to do a little bit of healthy behavior jamming.
But why is it not just enough to give someone a piece of paper that says move more?
Oh, because humans react in many, many different ways and need lots of different little pokes and things like that. And there are different motivations for how you engage with your body and for me, right? And it's a very complicated sort of matrix of behaviors that are good for some humans, not good for others. And I think we're in the beginnings of how to figure that out, or at least coming up with what is that galaxy of behavior changes and how do I do it emotionally, biologically, physically, and then coming up with this whole sort of strata or a whole model I think would be really neat in order to sort of start poking people the right way. Poking people is probably not the right word, but getting them to care a bit and to change. It's really human behavior and changing people, freaking hard problem.
Amen, it really is. But I'm glad we have people like you strategizing.
Well, I don't know anything about it. I just stayed at Motel 8.
I don't believe that. Thanks so much for speaking with me.
Thank you.